Thank you, Dr. Rachna, for your time today. I wanted to ask you a few questions regarding the lives of senior citizens in these times of corona pandemic. Let me start with my first question. Uh, the health of the senior citizens. They are all feeling very anxious in these times of corona. What would your advice be for them?
Yeah, I'm glad you asked. Maintaining good mental health at this time is very, very important. I'm being asked this question a lot. A lot of seniors are feeling quite anxious and panicked in their homes as they read reports that seniors are most vulnerable to this virus. And a lot of media is totally full of this all day long. So, here are a couple of practical suggestions. One, I would suggest for them that to limit your media influx, have one or two times during the day that you listen to the news, maybe a newspaper a day, but then that's it. More information is not helpful at this time. Stay focused on staying mentally positive. Do activities that help you with this. Those that are lucky to have families and children around them, I would encourage the families to spend quality time with them, even if not quantity. Talk to them about their experiences, their childhood, tough times in their life that they were able to overcome. And in invoking these memories, my hope is that there is a positive rush of emotion, of inspiration, of strength that the senior citizens themselves start feeling. And that's what we want to build on. Have some light times. Play easy games, your childhood games, cards, ludos. Your family may have a preference, Monopoly, anything. Maybe you can help seniors in the family set up family Zoom calls where family members from the other parts of the country are connected, or using any of the other apps. I'd like to give a couple of examples from my own home. My mother in law gets together with her friends and they do a bhajan singing session, which both elevates the mood and spirit and contributes to her spirituality. My mother herself has taken to making old traditional recipes, and she connects with other friends and families on WhatsApp chats, gets those, and busies herself doing this task. So, to each their own. But the most important thing is to maintain some sort of a routine. Make sure you're allowing for positive, happy events to also take place during your life and not flooded completely by some of sort of the negative reports, or right now very scary reports that are coming in on media.
Thank you. So the second question is on people who have medical problems. So there are many who have current medical problems, but unfortunately at this time they're not able to go and see their doctor. So what would your advice be for them?
Yes, that is a concern. I would say that most doctors, most hospitals are now providing services via telemedicine options, which could be a simple telephone call, an SMS chat, or a video call. And this also has been fast tracked and approved by the ministry. So you could reach out to your doctor or hospital in this manner if you need to. Make sure that your medicines are in stock. Don't overstock, because that will lead to problem for other people. But make sure you're taking your regular medicines on a regular basis. Don't miss that. That is one of the most important ways to avoid trouble. So I think these would be some suggestions from my side.
Excellent. Uh, what do you think they should do to stay physically fit at this time?
Yeah, many people ask me this because they used to be able to go for walks around the park, or senior centers or yoga clubs, and this right now, as we know, is not allowed. So people are coming up with ingenious options. Some have balconies where they come and do their yoga or pranayam, uh, or they can walk up and down driveways of their home. Even in their own homes, you can just do a standing light march. So many different options are there. The internet can be helpful, but stay active. This is very important. One other very important thing I'd like to mention is that make sure you're not sitting for long periods. This can happen with senior citizens if they're watching something or engrossed in an activity. Make sure they're getting up at least every 1.5 hours to 2 hours to avoid the risk of blood clots forming in their legs. So this is very important. Stay active, do some housework, innovate on what kinds of activities you can now do at home that you used to be able to do outside. Definitely breathing exercises, pranayam, is something everybody can do, and it's good for everyone. So pick a couple of options and stick to a routine. That is most important.
Thank you. What should they do to maintain hygiene during these times? Because that's obviously very critical.
I'm glad you asked. Every day we're getting reports of some new way the virus is being transmitted. Just today I read in the papers that there was a pizza delivery boy, and 69 people are affected from, or could be affected from getting pizza from that person. In many homes, senior citizens are helping out at home. They are handling fruits and vegetables or groceries that are coming in. I would advise extra care with the senior citizen population. As I said, data is still coming in about this virus and its transmissibility, so it's best to be cautious. I would like to reiterate that groceries coming in from the outside, those that do not spoil, put them in a separate bag, put them in a separate area of the house or an outside area for at least 2 days, and then utilize them. Wash hands every time you handle anything coming in from the outside, and do not touch your face. As for fruits and vegetables, those with thick skins, my suggestion is to wash them in soapy water. That water can then be used for bathrooms or other things, so you're not wasting water as well. So, and doorknobs, handles, fridge handles, these are handled frequently by various people, so one should make an attempt to wipe these with a minimum of soapy water and keep them clean. So most importantly, for anything coming in from the outside, senior citizens should be extra careful. If you are discarding packages that came from the outside, put them in a separate bag, keep them outside for 2 days, and then discard them to your garbage collector. So even then, they are safe. Wear a mask if you're receiving any home deliveries, medicines or groceries or anything. You wear your triple layered mask that you made at home. Don't leave anything to chance. Try and make payments electronic if that's possible, and minimum handling of cash. So these are a few practical tips that I hope are helpful for our viewers.
That's excellent. What vitamins and supplements should they be taking at this time?
There are some studies that are saying that adequate amounts of vitamin D are helpful. So not to overdose. If you have recent blood tests that were there and that were low, make sure that your vitamin D supplementation is good. You can check in with your doctor for this. Other vitamins like B complex, vitamin C, these are all helpful. Then there are some foods that are in our Indian system, in Ayurveda, are generally considered to be helpful and nutritious. So things like amla, tulsi, definitely all these would be helpful. Don't be misled that they're going to prevent the virus, but certainly no harm in consuming some of these. You can also check the government's Ayush website for more details on Ayurvedic supplements that could be consumed at this time.
Thank you, Doctor. One last question. There are many senior citizens who live alone and don't have the help at home. Any special advice for them?
Yes. I would encourage that if you have neighborhood groups, many people are proactively also doing this, that of senior citizens who are living alone, reach out. Make sure that they have what they need and they're being cared for. As I said, many RWA and many groups I know of are already doing this. So as younger citizens, it's our responsibility, I think, and compassion to be able to help these seniors. For the seniors who are living alone, if you're in touch with your family members, have them help you come up with a care plan. God forbid something should happen, you fall sick, whether it's COVID or something else, what are you going to do? Who are you going to call? What are some ambulance numbers? What is the closest hospital that will still be open that you can go to? So have a care plan already in place so that you're not sort of scrambling or fumbling at the last minute. And one very important aspect that should be taken in the right spirit at this time, and I would not feel that my advice is complete if I didn't touch upon this topic, which in my years of working with senior citizens, I regularly bring up, and it's more important at this time, is discussing end-of-life care. This is a discussion every family should have, and especially with their senior citizens, that God forbid, if a serious illness was to strike or a serious COVID pneumonia, would they like to be in the hospital on a ventilator, or would they like to be, if it's possible, at home in the comfort of their loved ones? So this discussion is one that every family should have, and the wishes of the senior should be known to the family members who will be called upon to make the decision should the family member fall sick. So not to, be negative or anything, but I think it's a very practical and important discussion. It happens in the West regularly, where every patient who comes into the care of the hospital is asked to declare their wishes. So it's a regular practice, it's nothing unusual or new, but I do think that families should have this discussion.
Thank you so much, Doctor, for your time today. These were very interesting and important insights you've given us today. Thank you.
Thank you. Stay safe and healthy, everybody.